Welcome to the Michael Blum Show, where we talk about things you don't want to talk about. We talk about sex. We talk about politics. We talk spirituality and substance abuse. Join us by calling 800-699-0980. Think, speak, and be heard. Here now is Michael Blum.
Now, wasn't that really classy, everybody? Huh? You saw my face now. You saw the placard. You saw the video. You've seen everything there is to see. Thank you so much and have a good evening. Well, anyway, folks, now really, welcome to the Michael Blum Show. Back in session here in 2019. I'm recording this and streaming this live from beautiful Boca Raton, Florida, where actually we're experiencing, laughingly, what we call Floridian winter. It's it must be a 62 degrees, 63 degrees out. So everyone has, their sweaters on. And if you live in Tampa or some of the other elder places, they have two sets of sweaters on. And that's what they're doing. So, folks, again, just a little bit of the paperwork before we get started. We do have a guest on the show. I'm excited to be talking about healthcare as a doctor myself, a doctor of dentistry. Generally, I don't talk dentistry at all if you'd followed my show. Every now and then I'll get a call about it, which, by the way, you could do if you'd like. If you want to join the conversation, feel free to do so. The number is 800-699-0980. Again, 800-699-0980. And we're going to get into some of the healthcare issues that we face today, as well as what healthcare was like maybe quite a few years ago. We do have Dr. William Northwell, who's going to be joining us momentarily. I just want to get through the paperwork, as I call it. Again, if you want to listen to the show is available through multiple streams. Right now, we are streaming to Facebook. We are streaming to YouTube. We are streaming to Twitter. We are streaming to Periscope. Later on, after the shows are edited, we will be streaming. You can get us on iTunes. We'll be on SoundCloud, Mixcloud, and a whole bunch of other places. Sometimes it's very slow to get people to listen and watch, and sometimes it just booms. We'll see how healthcare does today in that regard. So if you're listening to me now, you must know how to be listening to me. So you can either friend me on Facebook or on Twitter, or you can simply go to michaelblumshow.com, which is where I go to. I have very, very small ears, and these things just always pop out. So I'm going to see, I think, put that in there, and in there. All right. That may be a little bit better. So anyway, you can certainly go to michaelblumshow.com, and it says listen/watch now. Go there and pick the stream that your heart desires and watch us there as well. And again, we do take calls from time to time, even though sometimes they interrupt my train of thought with the person I'm interviewing, but that's the nature of the beast. Give us a call, 800-699-0980. Now, we're going to have Dr. William Northwell on now. He's a retired radiologist, and he's not really afraid to speak his mind. I spoke to him yesterday a little bit and today before the show a little bit, and he has a unique perspective on medicine and healthcare, and it's a very conservative one. So, folks, liberals, all those single-payer people, get ready to call up and we'll talk. 800-699-0980. It's one of the few places that you can talk as a liberal, and I won't jump down your throat unless you are a really complete idiot and moron. And then I certainly will jump down your throat, and we'll have fun anyway at your expense. So feel free to go ahead and give us a call if you'd like. But anyway, 30 years of practice, 20 years retired. He started writing on how come this healthcare system is just such a broken system as it is right now. And so he's always been interested in economics. Writing, he has a book out, Return to Capitalism, which we'll talk about in a little bit. And basically, he favors a much more capitalistic view of healthcare and how that would work as compared to where we seem to be heading, which is socialism and redefining healthcare as a right, which it isn't really, but I can understand people's concern because all you got is your health. I don't care what you have in your life, where you are in your life, how much money you have in your life. If you don't have health, you don't have quality of life, you really don't have anything at all. It doesn't make a difference. Just a little bit more background in terms of expertise. He attended Westminster College in Missouri. got a bachelor's there, and then went to University of Nebraska for medical degrees, and he was a radiology resident, and so forth and so on. And I want to welcome to the show Dr. Northwell. And how you doing tonight, Doctor?
I'm excellent.
You look like you're in good health. You exercise and do that kind of crazy stuff?
Well, I try and stay fit. I do walk and, well, I ski a little and uh, I'm outdoors quite a bit. And I live in Tampa, Florida. So, like you said, we're having a little cold weather up here to Florida winter.
Oh, so
And
you're in Tampa.
I am.
Oh, okay. I thought you were from the heartland, or is that just in your background?
No, I moved down from Omaha after I retired from medicine. Moved down for the water down here. At the time, I had a sailboat. Anyway, we love it down here in Florida.
Yeah, Florida is a cool place. I moved down here after I did. Well, actually, I did my residency in Miami. So after I was done in New Jersey, where I graduated from, the University of Medicine and Dentistry of New Jersey, I came down here and I felt it was the only place I could really like own a piece of Fort Lauderdale. Within a year or two of practice, I garnished enough money that I was able to buy my own practice and my own place and my own land and all of that. I don't think I could have done that at a corner lot in Omaha or Boston. Maybe Omaha, I don't know, but certainly not. So anyway, you've written a book here. You have a very, very capitalistic view of medicine. I am curious, since you can go back, when did you graduate medical school again?
I graduated in 1967, and of course, Medicare was enacted by Congress in 1965. So I heard the stories from the doctors that were around me when I was in training about what it was like prior to Medicare. Medicare just sort of changed everything. Once the government gets involved, it doesn't turn out very well, in my opinion.
That should be obvious to everyone out there. I'm going to put up a dual screen here. You may have to move around a little bit when you see this because I want you to be on camera. Let me get the right one up here. Okay. And we should be all right. There we go. Do you see yourself, sir?
I can, Michael.
All right, good, good. So then we can talk kind of face to face, if you will. So graduated in 1967, you said, and that's in and around the birth of Medicare as we know it. So I don't know if the other physicians, the older guys that taught you, called it the golden age of medicine or what they did or how that worked. But I'm just curious. I want to go a little bit back further. Is this something that you always wanted to be? I mean, like, were you sitting like in second grade, third grade class going, one day I want to be a doctor?
A lot of my parents' friends were doctors, so I had a lot of exposure to medicine. I was interested in engineering and sort of floated between medicine and engineering and ended up in radiology, which in a way is sort of a form of engineering. And I love physics, but radiology was really wonderful for me. But it just so happens that we had two family friends that were two of the first radiologists to enter the state of Nebraska back in the 1930s. And so I knew all about radiology before I got to med school. But anyway, doctors back then would tell me what it was like before government got involved. And the thing that was surprising to me, especially when I do internships and externships in small towns, they said everybody in town was cared for. And the doctor just took care of if they were poor, they took care of them, didn't bother trying to collect money from them. And everybody got pretty darn good health care back then for, how the level of medicine was at that era.
And in terms of cost and availability and all of that, how'd that all work back then? Way back when?
Well, I think doctors back in the 60s tried to really be frugal and charge patients a very small amount, and it was certainly easy access to doctors back in there. That's changed a lot today.
Well, I think it, by necessity, had to change. And I can give you my theory because obviously I go to doctors, and And I am a dentist, so I kind of know how that all works with dental insurance, which is kind of a funny thing to call it. But I do understand that. Now, in dentistry, insurance is considered a lost leader. There are two types of insurance. One may give you a discount, like a discount plan, which is fine, and the other one basically gives you $1,000 worth of benefit. Now, in 1967, in and around the same time when Medicare was born, so was dental insurance. And back then, the maximum amount you could use is $1,000 a year per calendar year. And that paid for a lot back in 1967. But now your premiums have gone up and all that, but the maximum today remains the same, $1,000. And that's less than the cost of doing a single crown or anything like that. So doctors who are dentists look at all of this, the insurance stuff is kind of a loss leader. All right, yeah, you need $6,000 worth of work. Well, we'll take $1,000 off. That's covered with your insurance. Pay me the rest. And that's kind of like the mindset. So how you get people to, and it's funny because I tell people I sell bridges because I actually did, but they're dental bridges. And what you'd have to do is you have to have a lot of customer care. The patients don't need me. I need them. It's not like, they can get service wherever they want and they're paying for it. So what you mentioned about, giving breaks here and there and treating somebody who doesn't have any money because he's a family member of someone else and all those things, that still exists in dental practice. All of that still exists in dental practice because the insurance and the government hasn't gotten a real good lock on the dentists yet. We're not all sitting in the hospital like a bunch of ducks in a shooting pond. So it's been different. But my point is when I go on the medical side, when I go there, it's the exact opposite. It's almost like I am a marker or a number to get paid. I don't pay the doctor. That's an insurance company that pays the doctor. So the doctor listens not to me necessarily or what's going with me, but has to listen to what the insurance company says. I have some friends who are emergency room physicians, and basically they say that the doctors don't decide treatment anymore, really. That all comes down from the insurance companies, from those people that do that. And why is that the case? That's the case because there is no real incentive for the physicians anymore to have to go ahead and give any level of customer service. Some do, but that's certainly not necessary in medicine at all because the patient is not paying you directly. You're going through different parties that are paying you. That makes sense to you?
Doesn't have to actually shell out the dollars out of their pocket for their medical care, whether it's the insurance or government paying for it. They sort of lose the incentive to shop for, the lowest price.
No, what you shop for, what you wind up shopping for is who's on your plan or not, because it's all insurance based.
Yeah, this has not been a good thing for medicine, if you ask me, and not been a good thing for the public or the patient.
And reasons why? Pretty much what I said.
Patients, they've sort of given up the incentive to, shop for value and the lowest price when somebody else is paying for it.
Yeah, look, someone comes to me, they say, how much is a crown? I could tell them it's $1,500. And that's the end of the story. You go to a doctor after you've broken your leg and you ask, well, how much am I going to pay? And, you get a song and a dance because they have no idea. They have no idea because they have to submit the claims for one of the 800 companies they're dealing with. And there may have been a negotiated rate, a non-negotiated rate, people still think that Medicare actually negotiates rates. They don't negotiate. It's the goddamn government. Why do they have to negotiate? They'll just give you an idiotically low amount of a low fee for the doctor, and then the doctors go, holy crap. How the heck can we make money with this system? Well, we'll have to see a patient every 10 minutes in order to go do that. We'll have to get rid of some of this medical equipment from here because that's going to be too costly to run. And maybe we'll forget these one or two studies that they're doing at because we don't have enough money to do that. And then you start to get, I think you would agree with me, an intense deterioration in what actually is medical care. And I make the distinguish between, what insurance, medical insurance, and medical care. They're really two different entities, in my opinion. One of them has, one of them depends on quality. And the other one is just a matter of you being covered somewhere for something. So I'm curious, you practiced a long time ago. Do you see any of the modern technologies coming out now? I read an article about some people that are trying to do like Uber doctors. So like you'd use your Uber app for a cab. You do something similar for a doctor who would then come to your house and make a house call for a fee. Do you see technology getting into this and making this better at all? Or do you think that we're going to be entering to a downward spiral as it becomes more of a common desire to have the government run healthcare?
Well, what I see is a rise of these medical complexes, huge hospitals systems that hire doctors, and so many of the doctors are on salary. And my problem at this stage of my life is as you get older, you have more disabilities, infirmities, things that go wrong. You need more doctors. You need an eye doctor for cataract. You need hearing doctors, and you have arthritis and so forth. And my problem is getting access. And I call up to make an appointment with a specialist, and a lot of times it's, well, we can't get you in for about 6 weeks. So I'm lamenting to my orthopedic surgeon who's taking care of some back issues. I said, 20 years ago when I was in practice, I could have gotten into any doctor's office I needed to see, usually that day. And today, it just takes forever to get to see a doctor. And my orthopedic surgeon, he's probably about 60, 65, and he said, Bill, used to be 20 years ago, I could get in to see any doctor here in town. And St. Petersburg's a pretty big town. And he said, today, I can't get in either for weeks. And he said, these doctors today, they're on a salary. They don't want to work. They don't want to accept any new patients. And, when you think about it, let's say 20 people call in a day to make an appointment, and the doctor sees 20 patients a day. There should be no backlog. You should be able to get in, in a couple of days or something like that. But that's just one of the things. The access to care is deteriorated. And people will ask me, what does government need to do to improve this? And I go, get government out of medicine. It's just the most important people in the whole scheme of events in healthcare is the medical doctor. It's not government, it's not insurance companies. But I don't know how we get this thing reversed right now. Government's accounting for about 50% of health care, and whether that's Medicare, Medicaid, the VA, and so forth. But and most of the remaining ones are getting their health care from their employer, so there's only about 20 million left in the country that have to get it on their own. But I don't know, and Medicare is headed for bankruptcy. Most experts say it's already bankrupt. But we all know about government debt, and taxes are high, and here the Congress is running a budget deficit of now about $1 trillion a year. And that means every year when another trillion gets added, currently there are 22 trillion of debt.
Mm-hmm. I want to let people realize out there, we throw numbers around and words around quite a bit. $1 trillion is a really big number. Just to put it into perspective, 1 trillion seconds ago is about 36,000 years ago. So when we're talking about, we're 20 trillion in debt, or we need $1 trillion per year, That's the ridiculously large level of debt that we're accumulating. It's not a small amount. This is like really, really significant.
Oh, it's an amount that's just incomprehensible. And yeah, I hate to throw numbers around like that, but the public, in the national debate, the discourse, what's on the cable news and on the front pages of the newspaper today, there's no talk about the debt. Eventually, there's going to have to be. But anyway, back to our federal government, so much of the federal budget, over half of it is for our social programs, both Social Security, but good share of that Medicare and Medicaid. And those programs are unsustainable. And nobody's come to realize that. They say, well, how can we improve Medicare? Or maybe what we need is Medicare for all. Well, that would be a disaster. First of all, there aren't enough doctors to take care of all the patients and the public's demand for health care, especially when they're not going to have to pay for it, out of their own pocket. So
it's true. My mother goes to get her toenails clipped because it's covered under Medicare. So she goes ahead and she sees a podiatrist for that.
Oh, yeah, that's just what we're talking about.
So I understand completely where you're coming from with all of this. Folks, what does the government run successfully? I mean, if you think that the government can't mail a damn letter without losing money on it. The United States actually has the largest hospital system in the world. It's called the Veterans Administration Hospital System. Look what's happened with that. You go there to die, not to get well. And I say that, I felt some of that when I was a resident at the Miami VA. And I said, wow, this is a phenomenal place for me to learn. I'm going to learn a lot here. I said, but God forbid I'm ever a patient. So you have absolute 100% proof that the government will fail. They fail continually and constantly. One of my mathematic formulas is anything, X, plus politics, equals BS. That's just how it always goes. Once you add the government and politics into anything, the concern is not you. The concern is someone's cousin or uncle or someone who gave from the American Medical Association needs to get paid back for their large donations to this candidate, to that candidate. It's an absolute lack of control over anything because the government has no reason to control anything. It really doesn't. And I want to play a video because I think it would be pretty cool to do it this time because it addresses an old concept as to why this cannot work. And it's very, very simple.
Today, the United States faces a healthcare crisis. Medical costs are too high, and health insurance is out of reach for the poor. The cure is obvious to nearly everybody. Government must step in to solve the problem. 80 years ago, Americans were also told their nation was facing a healthcare crisis. Back then, the complaint was that medical costs were too low and that health insurance was too accessible. But in that era, too, government stepped forward to solve the problem, and boy, did they solve it. In the late 19th and early 20th centuries, one of the primary sources of healthcare and health insurance for the working poor in Britain, Australia, and the United States was the Fraternal Society. Fraternal societies, or friendly societies in Britain and Australia, were voluntary mutual aid associations. Over 1/4 of all American adults were members of fraternal societies in 1920. Fraternal societies were particularly popular among blacks and immigrants. A fraternal society was a group of working-class people who formed an association and paid monthly fees into the association's fund. Individual members would then be able to draw on the pooled resources in times of need. There were a great many societies to choose from. Their most commonly offered services were life insurance, disability insurance, and lodge practice. Lodge practice meant that the lodge would retain a doctor to provide medical care to its members. Members would pay a yearly fee and then call on the doctor's services as needed. If members were unhappy with the doctor, the contract might not be renewed. Most remarkable was the low cost at which these medical services were provided. At the turn of the century, an average worker's daily wage would pay for a year's worth of medical care, much cheaper than on the regular market. Yet, licensed physicians competed vigorously for lodge contracts, perhaps because of the security they offered. This competition kept members' costs low. The response of the medical establishment, both in America and in Britain, was one of outrage. Many saw it as a blow to the dignity of the profession that trained physicians should be eagerly bidding for the chance to serve lower-class tradesmen. Such low fees, many doctors complained, were bankrupting the medical profession. Socially inferior people were setting physicians' fees and sitting in judgment to determine whether their services had been satisfactory. They demanded that the government must do something. And so it did. In Britain, state-financed medical care crowded out lodge practice. A working-class person, now being forced to pay taxes for free health care, was very unlikely to also pay for health care through the fraternal societies. In America, a similar process unfolded. Medical associations, like the AMA, had been granted the political privilege of control over the medical licensure procedure. The associations used this power to impose sanctions on doctors who dared to sign lodge practice contracts. Doctors could be denied the use of hospital facilities or expelled from the association. The effort to destroy lodge practice even extended to denying emergency medical care to lodge members. The AMA also made the requirements for getting a medical license much stricter, ostensibly to raise the quality of medical care. But the result was that the vast pool of physicians bidding for lodge practice contracts disappeared. This artificial restriction on the supply of medical care dramatically reduced competition, which resulted in higher prices. This hit the working-class lodge members especially hard. The final blow to lodge practice was struck by the fraternal societies themselves. The National Fraternal Congress successfully lobbied government for laws setting a legal minimum on membership fees that fraternal societies could charge. Perhaps the Congress did so hoping to benefit from cartel pricing, but thanks to the higher membership fees, the societies ended up losing even more members to industrial insurance firms and the welfare state, which eventually replaced them. Collectively, government interventions destroyed the mutual aid healthcare system, and with it, the availability of low-cost healthcare to the working poor. We can only guess at how lodge practice would have developed if it had been allowed to continue, and what innovations we've missed out on since competition in the medical world was hobbled. One thing does seem clear. We have a crisis in healthcare costs today because government solved the last one.
And there you have it, folks. Government working for you. As Ronald Reagan said, frightening words. I'm from the government. I am here to help you. So that's a little bit of history, actually, of what's gone on in the past in medicine, and where we are today is in quite a different place. I'm curious if do you have any information on how a drug price is set? How does that all work? Because some drugs right now, they're like really, really cheap, and other things are just like unbelievably expensive. So I'm curious if you have any background in that, doctor. You could tell us a little bit about pricing and how that works and what you think is going to go on in the future with drug pricing, because everyone seems concerned with it, which means that nothing, actually. Politically means nothing. It's called lip service. Everyone seems to be concerned with it, but no one's doing anything about it. And whenever I see that happen, you just trace the money and you find out why.
Well, my first comment would be when Obama was promoting his Obamacare, he basically gave a blank check to the pharmaceutical industry. He's trying to get their support for Obamacare, and he was making various deals with different groups trying to get their support. And the pharmaceutical industry just took that blank check idea and ran with it. And some of the prescription medicines that I need have probably gone up 4 or 5 times what I paid, say, 10 years ago. Now, President Trump has appointed a very capable person at the Food and Drug Administration that's really burrowing into some of these costs and trying to promote generic pharmaceuticals and so forth. But this is a whole other subject. I mean, people worry about the cost of their health insurance. They worry about the doctor's charge. They worry about the hospital charge. Very little is in the national debate on the drug industry charges and what it costs for, you know, if you're a 50-year-old, 60-year-old, and you require 2 or 3 different meds for hypertension and so forth. These costs for these pharmaceuticals have just ballooned. And anyway, that's a little beyond my field of training. All I can say is that the pharmaceutical costs are really a problem today. Hopefully, the Trump administration is going to try and get some handle on that. I would hope so.
I would hope so too, but the Trump administration, as it stands now, is not going to get any support. Even though the Democrats supported this, I remember even this is before the president was elected, maybe before he was nominated. Someone had asked someone on the from the DNC, I think it was Brazil was her name. I don't remember the first name. About that, Trump is for very, very similar plan to the Democrats in terms of reducing the cost of pharmaceuticals. And even back then, she said, well, I would have to look at it. I don't believe it could really be the same. And so basically, you know, if it's Trump that's doing it, it's just no good. It will not happen. So any law or anything that's really would be beneficial for the United States, forget about it, because the current Democratic Party, which is being controlled by their left-wing radicals, has no intention. Also, the mainstream, they have no intentions on giving Trump the time of day, yet alone anything that could potentially be used as political clout in a future election. So I have a feeling that I'm happy the government's shut down. I'm sure it's affected you greatly, you know. I think they should be shut down for a long time because I don't think government does anything other than waste our money for the most part. The thing it's supposed to do, protect us, it doesn't do. And everything else it just screws up so that it becomes expensive and ridiculous. And I'm weary of the healthcare industry. You know, we mentioned drugs. I don't understand why I'm watching a show on, let's say, CBS, and every commercial break has a drug in it. Whatever this one is for. There's lots of them. And the answer, again, if you follow money, the answer is you never will see anyone on 60 Minutes take on a drug company. They can't because they pay the network so much money in donation. Same thing with in the government. The government is no longer. This is not a government for the people. If you think that, then you're an idiot. And I think you should call us up and we can get you some psychiatric help. The number is 800-699-0980. You know, if you think the government is for the people, then you're nuts. The government right now is for the government. That's what the government's for. Protecting its own ass, keeping its own clout, keeping it as an elitist club, which it's become. And you don't even appear on the list as a concern. The only time you appear on the list of concern is during election. And they'll try to get rid of that, too. That's where we're going with it. You know, I mean, you had this stuff in Florida. Well, how come they can't count a ballot? I guarantee, as sure as I'm here, someone at some point in time is going to say, they can't even count ballots. Why are we even doing elections anymore? They're silly. It don't make sense. Let's get rid of the Electoral College. This way California and New York can decide who the president will be forever. You know? I mean, folks, if you think that they can handle health care, you're going to die. Because that's what's going to happen when they start to handle health care. And, the leftists say you're going to die, people are going to die because of this shutdown. There are people going hungry because of the shutdown. Meanwhile, Pelosi's vacationing at some 5-star resort in Hawaii. And everyone who's been furloughed makes over 6 figures a year, and they're taking a paid vacation. No one's dying from this, but that's just the rhetoric that you get so continually that it would just, if you listen to that, you're not listening to news, you're listening to, opinion news. Opinion, that's all it is. There really is no news on anything like that. having said all that and having painted such a rosy picture for things, how do you think the future is going to wind up for healthcare?
Well, I don't really make predictions.
Oh, go ahead. It's fun.
I'm a little pessimistic right now, and I just don't have a clue where things are going to go. It doesn't look very good to me.
All right, so you think that in the next year things will change negatively?
Here's the big thing in healthcare. It's people that take care of people. The medical doctor, the nurse, the physical therapist, the people that you meet when you go into a hospital setting or healthcare setting. It's not government, it's not insurance companies. And so let's say the government takes it all over. I have to wonder where these people that perform the services are going to come from. It takes a long time to prepare a medical doctor, long years of training and so forth. Future possible candidates for medicine are just going to go to something else, go to Silicon Valley or go to corporations, manufacturing jobs. Why would they go into something that the future is so bleak? And there's not going to be enough medical personnel, the doctors, the nurses, and the like, the people that take care of people. There's not going to be enough of these people to take care of the whole population if it's all totally taken over by the government. So I hope the people listening, the people, the electorate out there, let them cogitate on this. I don't think most of the electorate, though, is really too concerned about the problem, but it's a problem.
Oh, absolutely. And, to that effect, I'd like to do another video if I could. You have some more time? You can kind of hang out for a couple of more minutes?
I do. And I just want to put in a plug for my book.
Oh, let's go. We can do that right now. Sure. Go ahead.
Yeah, my book is Return to Capitalism. It's on Amazon. It's for sale at Barnes & Noble. And my name is Northwall, Northwall, Northwall like South Wall, East Wall, William Northwall. So you can either put in my name into Amazon or Barnes & Noble or Return to Capitalism. This is what my book looks like here, but anyway.
Well, absolutely. You said it's available on Amazon?
Say that again, Michael. I didn't hear that.
Sure. Available on Amazon?
It is.
All right. Awesome. Now, folks, we've been talking about healthcare. We're talking about pretty much why it won't work. If you do want to give us a call, I'm more than happy to entertain a phone call here, 800-699-0980. I want to explain to you economically why this will never work. And it's a very interesting concept. It eventually came from Milton Friedman, but this Prager University kind of little clip here explains it a hell of a lot better than I think I could or that Dr. Friedman could if I tried to find some news clip. And it's a very, very interesting.
Why is the government so bad at healthcare? They've been at it for 75 years and still can't get it right. It's expensive, access is spotty, it's mired in bureaucracy, and it's fraught with waste. Obamacare was supposed to fix all this, but instead, like every other government healthcare program before it, it just made things worse. Why? Because the government is a third-party payer. Let me explain. Suppose you're going to buy something for yourself. You have two priorities, price and quality. You want the highest quality for the lowest possible price. Say you're buying a television. You have many options, the size of the screen, the quality of the image, the price. Only you know which one best suits your needs and your budget. And a lot of companies are competing for your business. You do your research, you make your choice. This is called a first-party purchase. The person paying is the person using. Now let us suppose that either the price or the quality is not controlled by you. In this case, you're buying something for someone else. You care about the price because you're paying for it, but you're a little more flexible on the quality. A good example would be a wedding gift, say a coffee maker. You might think, by the time it breaks, they'll forget who gave it to them anyway. The cheaper one will be fine. All of us have bought things for others we never would have bought for ourselves. We care about the price because we're paying for it, but not so much about the quality because we're not going to use it. Or suppose we're going to use something, but we're not going to pay for it. Then we're concerned about the quality because we're consuming it. But the cost is not as important because we're not paying for it. Any father who ever got roped into paying for an open bar at a wedding understands this program. Nobody ever orders the cheap stuff when it's free. These are called second-party purchases. The person paying is not the person using. And now for the coup de grace. When it's not your money paying for something and you don't use it, then you're not concerned about either the price or the quality. Suppose the boss gives you $150 to buy a door prize for the office party. In a store window, you see a 6-foot-tall stuffed frog marked $149. You think, oh, that's perfect. Let's buy it. The raffle winner is awarded the 6-foot frog. Everyone laughs at the gag. Now, this is called a third-party purchase, a purchase that is made with money that's not yours. Therefore, you don't care about the cost. To buy something you're not going to consume, therefore, you don't care about the quality. Here's the point. By definition, all government purchases are third-party purchases. The government spends other people's money on things it won't consume. It doesn't care about the price or the quality. Thus, there will always be waste in government spending. That's why, to paraphrase Abraham Lincoln, government should do only those things that a man cannot do better for himself. If 300 million Americans were free to buy health insurance for themselves, just as they buy their own life and home and car insurance, then that little gecko on television would offer us health insurance with a little more coverage for a little less cost. And he wouldn't be the only one. Insurance companies and hospitals would be working night and day to get our business. Quality would go up, prices would go down. It's already happened with laser eye surgery. It used to cost $2,200 per eye. Now it can cost as low as $500 per eye. That's the way free enterprise competition works every time. But when the government gets involved, costs go up, waste and fraud go up, essential medical services are denied or unavailable. These are the hallmarks of government healthcare bureaucracies around the globe. The sooner we make health insurance a first-party purchase again, the sooner Americans will get the health care they want. Finally.
So what do you think?
Bravo.
Bravo.
Yeah,
That comes.
Really hits the nail on the head.
Yeah, I mean that comes from Milton Friedman. Said there's only 4 ways to spend money: spending your own on yourself, spending your own on someone else, spending someone else's money on yourself, and spending someone else's money on someone else. And that's the last one is government, where they really you don't really care. So I think that does pretty much sum it up. Any final thoughts or conclusions or anything you'd like to add, Doctor?
Well, it's a battle of capitalism versus socialism, and like Margaret Thatcher said, socialism's a great system until they run out of other people's money. And I don't know, in healthcare, just government got involved and it just is destroying it. And people think, well, then we need more government to improve what the problems that government caused in the first place. You just got to get government out of healthcare.
Yeah, and I think there's some sensible things that you could do. Once you get government out of healthcare, go ahead and, government regulation makes it that you can't go ahead and bargain across state lines. That's the government doing that to you. They're not permitting you to go ahead and say, well, I live in Florida. I want to go ahead and participate in plans that are offered in other states. It's they kind of stop you from doing that. If you could open that up, then you could have like a small business association that could be like the Marriott Corporation, and they could have bazillion members and go ahead and try to get lower premiums from the companies themselves. But it has nothing to do with government. Again, folks out there, government doesn't do anything right. What do they do right? There's almost nothing I can think of that the government does properly and in a good way. Oh, except collect your taxes. They've really honed down on the IRS and collecting your taxes. Of course, they've weaponized it and they use it against their enemies. It kind of is like a Gestapo for the United States, if you will. But there really is nothing that the government does that works well, my opinion. And the opinion of many others, I believe. So, folks, you've been listening to The Michael Blum Show. We're talking again with Dr. William Northwall. He does have his book out again. It's available on Amazon. I want to thank you for joining the show this evening. And again, the book is called Return to Capitalism. You wouldn't know it has to do with medicine, but it's actually... It's a concept that you could use rather universally. I mean, it's return to capitalism is really how we have to go. There is no successful country in existence now or that's ever been in existence that has not gotten their financial gain through capitalism or a free market system, period. You want to go to places that have rotten health care, no doctors? Go to the socialist countries. Go to the communist countries. You can see what goes on there. Like everyone's running to Moscow to go ahead and have their surgeries done. Anyway, I want to thank you so much for joining us this evening. Maybe we can do it again. I hope you have I wish you a lot of luck with your with the book and all of that good stuff. And hopefully I can speak to you in the future. Did that work out for you, Doc?
Oh, I'd love it. I love everything you said, Michael, and it's been a good show. Thanks for taking the time to have me.
Oh, my pleasure. If you'd like a copy, I'll go ahead. You can just send me your personal email address, and I'll get you a copy of everything. Just take a couple of days for me to edit it all out.
Super.
All right, take care now, folks. You've been listening to The Michael Blum Show. We're going to say goodnight for the evening. We do have kind of a lineup coming up. We're going to be talking about technology and how that'll affect you and how that can make you potentially jobless in the near future. But as in all technological revolutions, some doors close and some open. So we're going to have someone talk to us about that. And then the show after that, which will probably be the best attended one, is Your Right to be naked. It's your right to strip, your right to not have clothing, and that will be by our house nudist. If I can get her on video, that'd be pretty good. Internet, you can do almost anything here, unless it's too conservative. You know, you can show people's heads getting lopped off by ISIS, but you know, you say the wrong thing and it's not really politically correct. You have a problem. So we'll be talking about that in the near future. We have a program scheduled where we're talking about adult deficit disorders, and one on the female side of dating and how that works. So, folks, stay tuned. I want to wish everyone the best. And I want to thank everyone for listening, those who did listen. If you didn't listen, that's okay, too. Hopefully you'll be able to catch up with us and catch on to us. We are a weekly phenomenon on Tuesday evenings, 8 p.m., streaming live. You know, folks, everything in life is possible. Fewer things are probable. One thing is for certain, and that's that you're alive. So go out and live your life to its fullest, because tomorrow is promised to nobody. Speak to you next time around.